11 surprising signs of diabetes found in your feet. While most people are aware of common symptoms such as frequent urination, increased thirst, and fatigue, diabetes can also manifest in subtle ways through your feet. Tingling, numbness, or slow wound healing in your feet may seem insignificant, but they could actually be early indicators of underlying diabetes. By understanding and recognizing these lesser-known signs, individuals can seek timely medical attention and effectively manage their condition. Monitoring foot health, in addition to traditional symptoms, can also lead to earlier diagnosis and better management of diabetes-related complications. So, keep an eye on your feet and watch on to learn about these 11 surprising signs of diabetes found in your feet. Just a quick reminder, we are not doctors, and this information should not be considered as medical advice. This video is for informational purposes only. Now let's begin. Number 1. Persistent sores or ulcers. One of the more alarming indications of diabetes that can appear in your feet is the presence of persistent sores or ulcers. These troublesome wounds are not just a superficial concern, they act as red flags for more severe underlying health issues, including compromised circulation and impaired wound healing capabilities. Diabetic foot ulcers typically arise from a dangerous trifecta nerve damage which diminishes sensation and thus awareness of injuries, reduced blood flow, which hampers the healing process, and a heightened vulnerability to infections, making even minor wounds potentially perilous. The development of these ulcers often stems from everyday activities or slight injuries that go unnoticed due to neuropathy, thereby delaying treatment and increasing the risk of infections. Ignoring or inadequately treating these sores can precipitate grave outcomes, such as cellulitis, a severe bacterial skin infection, or osteomyelitis, an infection in the bones. Number 2. Edema or swelling. Edema or swelling in the feet is a significant sign that often accompanies diabetes, signaling potential complications that shouldn't be ignored. This swelling is primarily due to the body's inability to circulate fluid efficiently, a problem compounded by the high blood sugar levels characteristic of uncontrolled diabetes. Individuals with diabetes may notice their feet appear puffy or larger than usual, a condition that not only causes discomfort but can also impede normal movement and increase the likelihood of skin issues or infections. This is especially concerning for those with diabetic neuropathy, as they might not feel pain associated with such swelling, allowing it to progress unchecked. To manage and mitigate the risks associated with diabetic foot edema, incorporating lifestyle adjustments plays a pivotal role. Simple actions such as elevating the feet when sitting, ensuring adequate hydration, and wearing supportive footwear can have a substantial impact. Number 3. Numbness or tingling sensations. Numbness or tingling sensations, often described as a feeling of pins and needles in the feet, are indicative of diabetic neuropathy. This condition results from sustained high blood sugar levels causing damage to the nerves. Initially manifesting in the toes, these sensations can progressively envelop the feet, significantly reducing one's ability to perceive pain, discern temperature variations, or recognize pressure. This diminished sensory capability heightens the risk of unnoticed injuries. Without the immediate feedback of pain or discomfort, minor cuts, scrapes, or blisters might not receive the prompt care they require, setting the stage for more serious complications. The progression of these symptoms demands vigilant observation and care to avert the development of ulcers, infections, or deformities, all of which are considerable risks associated with diabetic neuropathy. Number 4. Skin color changes. Skin color changes in the feet are a notable indication of poor circulation, a condition often seen in those with diabetes due to narrowed blood vessels and a reduction in blood flow. Individuals may observe patches of skin that appear reddened, pale, or even possess a bluish hue, especially noticeable in the toes or feet. These discolorations are more than cosmetic concerns. They signal an underlying issue with circulation that can compromise the skin's natural healing abilities. As a result, the risk for developing ulcers, infections, and tissue damage escalates, making it imperative for individuals to monitor and seek medical advice for any noticeable changes in skin color. Recognizing these signs early and consulting with healthcare professionals can help manage symptoms and prevent more severe complications. Number 5. Skin texture changes. Skin texture changes in individuals with diabetes can vary widely, ranging from extreme dryness to cracking, or even a noticeable thickening of the skin on the feet. These conditions are often the result of diminished nerve function, which in turn affects the sweat gland's ability to maintain moisture. The lack of natural hydration can leave the skin vulnerable, creating openings through cracks or fissures that serve as entry points for infections. Especially for those suffering from diabetic neuropathy, these seemingly minor skin issues can escalate into more severe complications without proper attention. Keeping an eye out for any alterations in the skin's texture on the feet is an essential aspect of diabetic foot care. Before moving on to the next sign, I'd like to remind you to hit the subscribe and like buttons if you haven't already. Your support is crucial in enabling us to keep producing valuable content for you. Number 6. Slow healing. Slow healing of wounds or injuries on the feet stands out as a prominent sign of diabetes, fundamentally linked to diminished blood circulation, weakened immune response, and nerve deterioration. When blood sugar levels are consistently high, they disrupt the body's ability to repair itself efficiently, prolonging the recovery period for even minor injuries. This sluggish healing process is not just a direct consequence of diabetes itself, but is further complicated by associated conditions such as peripheral arterial disease, which restricts blood flow to the extremities, and diabetic neuropathy, which can delay the detection of wounds due to reduced sensation. These factors create a perfect storm, significantly heightening the likelihood of infection setting in and ulcers forming. Number 7. Poor circulation or cold feet. Poor circulation or cold feet are telltale signs of inadequate blood flow, a common issue for those with diabetes. This condition is primarily caused by the narrowing of blood vessels, which restricts the amount of blood that can flow to the lower extremities. Individuals might experience their feet feeling perpetually cold, a symptom that signals not enough warm blood is reaching these areas. Additionally, this restricted circulation can manifest as a paleness or even a bluish tint to the skin, underscoring the severity of the blood flow limitation. These symptoms are not merely discomforts, but serve as indicators of potential harm to the tissues of the feet due to insufficient oxygen and nutrients. Number 8. Hair loss on toes and lower legs. Hair loss on the toes and lower legs is a lesser known, but nonetheless telling, symptom of diabetes that can signal underlying problems such as poor circulation and nerve damage. When the blood flow to the extremities is compromised, essential nutrients and oxygen struggle to reach the hair follicles in these areas, resulting in a noticeable reduction of hair growth. This can leave the toes and lower legs looking unusually bare compared to their normal state. Furthermore, diabetic neuropathy, a condition arising from prolonged high blood sugar levels damaging nerves, can exacerbate this issue by interfering with the nerves that facilitate hair growth. Consequently, individuals may observe not only a decrease in hair quantity, but also changes in hair quality, such as thinner strands that are more prone to breaking. Number 9. Peripheral artery disease. Peripheral artery disease, PAD, stands as a significant concern for individuals with diabetes, marked by the constriction or obstruction of blood vessels in the legs and feet. This condition leads to a marked reduction in blood flow, exacerbating the risk of various complications. PAD is primarily fueled by the damaging effects of prolonged high glucose levels on the arterial walls, coupled with inflammation and the buildup of plaques. Those suffering from PAD might experience discomfort or cramping in the legs, known as claudication, during activities like walking or climbing stairs. A distinctive feature of PAD is the occurrence of slow-healing sores or ulcers on the feet, which, due to restricted blood flow, struggle to recover promptly. Additionally, a decrease in hair growth on the lower extremities or an unusual coldness in the legs and feet could indicate the presence of this vascular disease. Number 10. Foot deformities. Foot deformities in those with diabetes emerge as a direct consequence of nerve damage, poor circulation, and the unequal distribution of pressure across the feet. Conditions like Charcot foot, which leads to the weakening of the bones in the foot, hammer toes, characterized by bent toes due to weakened muscles, and bunions, painful bumps at the base of the big toe, are notably more common among diabetics. These deformities can cause significant structural changes, misalignment, and instability, which in turn elevates the risk of skin breakdown, ulceration, and joint damage. Such complications are not only painful, but also contribute to an increased risk of serious foot issues, including infections and the potential for lower limb amputation. It is crucial for individuals with diabetes to wear properly fitted shoes and seek regular podiatric care to manage or prevent these deformities, thereby minimizing the risk of more severe complications. Number 11. Frequent foot infections. Frequent foot infections are alarmingly common among individuals with diabetes, primarily due to the perfect storm of elevated glucose levels, decreased circulation, and compromised immune responses inherent in this condition. The high sugar environment in the blood provides an ideal breeding ground for both bacterial and fungal pathogens, making diabetics more prone to infections such as cellulitis, athlete's foot, and ulcers that are notoriously difficult to heal. Moreover, the diminished sensation resulting from nerve damage means these infections can advance significantly before being noticed, thereby increasing the risk of severe complications. Without timely and appropriate treatment, what might start as a seemingly minor infection can quickly escalate, potentially leading to gangrene or even systemic infection, situations that necessitate urgent medical intervention. Kindly keep in mind that we are not doctors, and the information provided here should not be regarded as medical advice. This video is purely for informational purposes. If you found this video helpful, then don't forget to like, share, and subscribe to our channel for more videos on health and wellness.